Our whole universe was in a hot, dense state that nearly 14 billion years ago expansion started. Wait, the earth began to cool, the autotrophs began to drool, Neanderthals developed tools, we built a wall. We built the pyramids, math, science, history, unraveling the mystery that all started with a big bang.
Penny, Penny, Penny.
What do you want, Sheldon?
There's a problem.
What's the problem, Sheldon?
You're in my seat.
What's the problem?
Well,
How'd you get an STD?
you see, I was at this Comic-Con in Florida this past weekend, and, you know, I found this Wonder Woman, and one thing led to another, and things just got out of hand.
It's not like you, Sheldon. Have you told Amy yet?
No.
Okay, well, before we tell her anything, we should look up some information about it. Have Chancroid, also known as Haemophilus ducei.
Haemophilus ducei, Penny. I'm hoping that your acting career is a little better than your pronunciation. Anyways, each bacteria, it says it's about 1.5 micrometers long by 0.5 micrometer wide, and it's a coccobacillus-shaped bacterium.
Says it's an STD that only affects humans, that humans are its reservoir, but it can also be transmitted through skin-on-skin contact. Bernadette's a microbiologist, right? Maybe you should go have her test you for it just so we're sure.
I'll go talk to her.
And while you're doing that, I'm gonna go tell Amy.
No!
Hey, Amy. Hey, Penny, what's up? I was just wondering if you know anything about Chancroid.
Oh, well, lucky for you, I researched Chancroid all through school, so I learned mostly about the pathogenesis. So first, the bacteria will enter. So it is often transmitted during genital contact during sexual intercourse. Now this bacteria is spread by direct contact with an infected lesion. Now it enters the skin tissue through small abrasions. After it enters, it has to attach to the host cell. So the bacteria attaches to the epithelium of the reproductive tract and also to the mucous membranes of lymph nodes. Now after it attaches, it has to overcome or avoid the host cell defenses. So since the pathogen only infects the outer epithelium surface layer, it avoids the host cell's immune system because it doesn't penetrate into the bloodstream.
Do you know anything else about it?
Of course. So the damage that the bacteria causes. They releases a cytotoxin, which results in inflammation of the surrounding tissue. Now this inflammation results in swelling and pus formation, ultimately resulting in a very sensitive ulcer. Then it has to exit the host. So if someone is infected with Chancroid and engages in sexual acts, abrasions in the lesions expel pus, which will allow for the bacteria to enter a new host.
No offense, Amy. I didn't understand any of that. When I said, do you know anything else, I meant more like the symptoms of Chancroid?
Oh, of course. Some of the clinical features. So it's normally found in men, mostly uncircumcised ones, but it can also be found in women. Now in females, painful urination, rectal bleeding, or painful intercourse may be indications of this infection. Now the incubation period is 4 to 10 days after exposure, and that's when you start to see a few bumps or sores appear on the genitalia. Now these bumps are full of pus, and after they rupture, a sensitive open sore is left. And if these open sores are not treated, an infection of the inguinal lymph nodes may occur.
That's gross.
Yeah, it is. So why do you ask, Penny?
Oh, no reason.
Well, I'm just so glad that Sheldon would never get into a disease like this.
About that, you should probably talk to Sheldon.
Wait, Penny, what?
Hi, Sheldon.
So, Penny sent me over here about something about Chancroid. Can you give me a test for that?
Yes. First, I'm going to need a swab with one of your ulcers.
Sure, 1 second. Alright, here you go.
Thank you. We're going to do 2 agar tests. One on gonococcal agar, and the second on Mueller-Hinton agar. I'll be right back to test these. Hi, Sheldon. I got your test results back. It looks like it's a gram-negative coccobacillus. To me, it looks like Haemophilus ducei. Causes Chancroids.
Alright, so what are my treatment options?
Your treatment option is ceftriaxone 250 milligrams intramuscularly in a single dose. Ceftriaxone is a bactericidal agent that acts by inhibition of bacterial cell wall synthesis.
Do you have any here for me?
Well, I don't, but you can go to your local pharmacy and get it for $30.
All right.
All right, I'll talk to him. Okay, bye, Penny. Sheldon, have a seat.
So you heard.
I did. And Chancroid is most commonly found in tropical areas. So the next time you have a Comic-Con in Florida, make sure you're abstinent and don't sleep with anybody. Or you can use a condom. So the next time you sleep with a Wonder Woman, you don't have to wonder about her.
Sheldon, we need to talk.
What's that good?
Sheldon, get back here.
Pyramids, math, science, history, unraveling the mystery that all started with a big bang. Since the dawn of man is really not that long, as every galaxy was bisected.